Hello, everyone, and welcome to the Exam 2 review session for Anatomy and Physiology 1. So, in this little video here, we're going to go over a little review of what we covered the last couple chapters. Remember, this exam covers Chapter 5, which is the integumentary system, Chapter 6, which is the skeletal tissue, and then Chapter 7, which is the bones. So, only 3 chapters in this one, but these 2 chapters right here are pretty heavy. So first, let's start with first an overview of the exam, because everyone always asks how many questions are on the exam. Similar to last exam, so there are 90 questions total, and I grade it out of 85 points. And then you have a 20-question practical with 1 bonus on that as well. And this practical is all geared towards the skeletal system, so make sure you study your bones. Yes, you have to know all the bones and many of the markings and foramens on those bones. Okay, so let's get right into it now. So the exam is then made up of matching true and false and multiple choice. So here, chapter 5 is integumentary. Remember, integumentary includes hair, skin, nails, and glands. So that's sweat glands and oil glands. So all the glands are included there as well. So we talked about the different layers of the skin. So the epidermis is the outermost layer. So the epidermis has different layers in it as well. So it has the stratum corneum, that stratum spinosum. So know the layers from the top to bottom. So the top layer is the stratum corneum. Then you have the stratum granulosum. Then you have the stratum spinosum, and then the stratum basal. There's also the stratum lucidum if it's thick skin, like in the hands or the feet. So know all the different parts there. And then we have the different cells that make up the skin as well. So first type of cells we have are the keratinocytes or keratinocytes. What do these make? These make keratin. So these cells produce keratin, which then they package keratin in them for protection once they get to the upper epidermis layer. And then we have melanocytes. These produce melanin. So melanin gets packaged into melanosomes, which then get released and then get put into keratinocytes. So melanin is a UV protector. So melanin protects us against UV light, which wants to damage our DNA. Well, not wants to, it just as a byproduct, it damages our DNA. So here, melanin protects us from UV damage. So that's why if you got into the sun, you get tan, because melanin is being put into your keratinocytes, which are the upper layer of your skin. So remember, our epidermis has innervation and is avascular. So it lacks blood vessels in that upper layer. Now the dermal layer, which is broken up into that reticular layer and the papillary layer, that does have vasculature. Remember, keratinization is touch sensation here. So one of these cells are called their tactile cells, which are sensing light pressure or light touch. Then you have dendritic cells in there as well. Dendritic cells are immune responders. So you remember immune for that one. What other cells do we have there? 1 second. I believe those are the important ones we need to know about. Yes, tactile cells, dendritic cells, keratinocytes, and melanocytes are all the important ones. So then you get down to your dermal layer, and you have the different layers down there. You have the hair that goes down in there. So the hair shaft is the part that sticks out. You have the free nerve endings around that hair bulb. Attached to the hair are the oil glands or sebaceous glands. And then you have your sweat glands, which are there as well, but they're not attached to the hair follicle. And then you have the muscle that's attached there as well. That gives you goosebumps. It's called the erector pili muscle. So don't forget what the erector pili muscle is. So, and then below the dermis layer, or the dermal layer. You then have the hypodermis, where you have the layer of adipose tissue and fat, which is responsible for shock absorption. So then here, sweat glands are also known as your sudoriferous glands. Sebaceous glands are your oil glands, and the ones that make you stink are called your apocrine glands, or the ones located in your armpits. They release a protein substance which bacteria eat and then cause body odor, and those ones aren't active until puberty. Remember when we talked about that. So that's all important. So on our hands, we also have these friction ridges that appear. So they're different among various people, but we know that between twins, they are very, very similar. So this suggests that these friction ridges are genetically determined. Those are the little bumps you have for your fingerprints, where there are little sweat pores in those ridges. So then we also need to know about the different degrees of burns. So first, second, and third degree burns. Third degree burns are critical when they're on hands, feet, or face. The only type of burn, which type of burn only damages the epidermis? That's a first degree burn. A second degree burn then goes down into the dermal layer, and a third degree burn destroys everything. And the most life-threatening results of severe burns are fluid loss, dehydration, and infection. Now, I'm not asking any of the percents for the burns, so I know we did that in the Kahoot, but you don't have to worry about that specifically. And then we talked a little bit about skin cancer, so make sure you know about the different kinds of cancer. The most dangerous form of skin cancer, 50% die from that, is melanoma, and that's a cancer of these melanocytes. And then there's basal cell carcinoma. That forms a little raised, shiny nodule that's of the keratinocytes here. And then there's squamous cell carcinoma. That forms like a little reddish patch that forms. And then, so that's back of the head and on the hands, that one's popular. But melanocytes and melanoma is the most dangerous one. And that's where you follow the little signs for watching your moles, because if they get a abnormal amount of pigment developed in them, like melanin here, that means there's a lot of production of that melanin going on, and you want to figure out why. So absorbing that UV light, again, is a purpose of that melanin. And for risk factors, the biggest risk factor for skin cancer, of course, is UV light out of all the other ones. So overexposure to UV radiation is the single most important risk factor for skin cancer. And then we talked about the nails a little bit. So remember, the nails do appear pink when you're not talking about the luneal or the tip of the nail. Tip of the nail is white, but the rest of the nail bed appears pink because you're looking at red blood cells underneath there in the dermis layer. And then the protein, the most abundant protein that's found in the epidermal cells here. So it's that keratin protein, so don't forget that one as well. What else do we have in the integumentary system? Again, there's no practical portion on this, but make sure you understand the different layers. So still look at the virtual lab. The virtual lab is still important. There's some important matching sections in there you want to check out that will help you on this portion of the exam. Also, the different colors that can appear on the skin. So we have erythema, that's a redness of the skin. We have pallor, that's a pale or blanched color of the skin. So it may also indicate fear, anger, anemia, or low blood pressure. But erythema may indicate an embarrassment, fever, hypertension, inflammation, or allergy. Then jaundice. Jaundice usually indicates a liver disorder, and it causes a yellowing. So jaun here is yellow of the skin. Another example here is Addison's disease. So the skin can present a lot of different ailments on it. These are just a couple. Hundreds of different ailments can express themselves on the skin. So this is a good symptomatic area to look at when trying to figure out the pathology of something. So then Addison's disease here was in a permanent tan or a bronzing of the skin. We'll talk about what Addison's disease is in a little more detail when we get to the endocrine system. And then the last one here is cyanosis. Cyan, blue. So cyanosis is a bluish color in light-skinned individuals. So understand the different skin colors there as well. And the different glands, what a sebaceous gland is, what an apocrine gland is, what a sudoriferous gland is, and so forth. So that's pretty much chapter 5. I know I didn't write a lot here, so I hope you paid attention to my words that I've been saying. But now, so the big part of this exam, even though integumentary is on it, is chapter 6 and 7. So chapter 6 here is bone tissue and markings. So these markings are important in chapter 7 then. Helps you name the bones. But here, so again, you want to look at the virtual labs and the quizzes for this one. So some of the stuff could be repeated from there since I'm not asking direct practical questions from these chapters. Now, because of the markings, some of these words you learned in this chapter will show up on that practical, but they won't be directly related to this chapter. So understand the anatomy of a long bone, the different regions of a long bone. So you have the epiphyses at the end, the diaphysis in the middle. You have your medullary cavity where you have your yellow marrow. You have your epiphyseal plate where the growth plate is. You have your spongy bone, your compact bone, and those different regions. So make sure you understand the different regions of a bone, of a long bone. And remember, flat bones are like we find in our skull, have that area of spongy bone in the middle. They don't have the area of yellow marrow or compact bone wrapped around. It doesn't have that hollow medullary cavity in flat bones. And all bones do not stop growing at the end of adolescence. We have some facial bones that do continue to grow throughout our lives. And then in our red bone marrow, we produce red blood cells. That's called hematopoiesis. Let me spell this right. E-O-I-esis. Hematopoiesis. So RBC, or red blood cell formation. It also forms white blood cells. But this happens in the red bone marrow. That's an important one. Oops. Red bone marrow. Yellow marrow stores fats for energy production. Now, in times of anemia, yellow marrow can convert to red bone marrow. So if you convert yellow bone marrow to red bone marrow, you form red blood cells. So anemia is low oxygen movement. So that would make sense that this yellow marrow can then produce red blood cells, which can then make more oxygen travel through the body. Let's see here. There's a lot in this chapter. So for the for the markings, make sure you know what each marking is. Know what a spine is. Know what a foramen is. Know what a faucet is. A ramus and a trochanter. They're all really, really important parts here. So, then you have a tuberosity, you have a condyle, you have an epicondyle. All these different parts will be coming back, and, they need to be part of your vocabulary to help you understand all these different parts. So look at your markings table and make sure you can identify all the different markings. You have the fossas and so forth, a process and whatnot. That's why we spent that time in the lab one day identifying these processes, because it will help you name different parts where muscles, ligaments attach, where arteries, veins, and nerves go, and things like that. And then we have the different cells that build a bone. So, we have osteogenic cells, which are the stem cells. I won't write that, but osteogenic are the ones that are the stem cells that become the rest of these. So we have osteogenic cells. We have osteoblasts. They build bone matrix or osseous tissue. Osteoclasts eat bone matrix, or it's called bone resorption. So when the body is low on calcium levels, a hormone is released called the parathyroid hormone, or PTH. It activates osteoclasts, calcium is then released into the blood. It's calcium 2+. Then, when calcium levels get high, osteoblasts are activated, and then we put the calcium back into the bone. Now, one thing that's required in this process here is estrogen in females and testosterone in males. And there are other hormones like leptin in our adipose tissue, which is also required as well, and some other factors are involved here too. The big one here is estrogen. So here in females, osteoclasts are being activated, but we're not getting those osteoblasts coming back in. So if you don't have the osteoblasts activated, that leads to something called osteoporosis. So here the osteoclasts are being activated, but osteoporosis is happening, which is bone porous. So bones become weak and brittle because you're not activating osteoblasts enough. And then the other diseases are osteomalacia, which is a softening of the bones where you don't get the mineral deposits. You don't get those calcium phosphates depositing on the bone matrix. So the bone appears soft. Malacia is soft. And then the other one was Paget's disease, where there's an abnormal growth of bone causing the bone curvature to change during at older ages. Now back to the cells here, or parts of the bone. We have the lamellae, which are the little layers of bone matrix, and the canaliculi, which are the small channels that radiate through the matrix of the bone. Don't screw that up with the perforating or Volkmann's canals, which are where the arteries and veins, so the nutrients, enter the middle of the bone and goes into then the central canals out. Within those canaliculi are usually sitting osteocytes. And those canaliculi are what connect those osteocytes so they communicate with each other. Then remember, there is the membrane inside the bone, that's called the endosteum, and then there's a membrane on the outside the bone, that's called the periosteum. Okay, so then going back a little bit, not only is our skeletal system composed of our bones, it's also composed of our cartilage. The most abundant type of skeletal cartilage is that hyaline cartilage. That fibrocartilage is found in our vertebral discs, pubic symphysis, and on the meniscus of our knee, and then elastic cartilage is found places like our epiglottis and the pinna of our ears. Going more then, so remember that epiphyseal plate is where bone growth occurs, and then so it's hyaline cartilage when we're younger, in adolescence, and after puberty, after growth stops, that slowly ossifies and then becomes compact bone later in life. When looking at the microscopic structural unit of a compact bone, that one single structural unit, remember, is called the osteon, which has that central canal in that middle. So here would be the central canal with those different lamellar rings circled around, and here the fibers are running different directions to provide strength. And then there might be another osteon right over here, but then in here this is called the interstitial lamella, which is the middle region, and outside the full bone is the circumferential lamella, the different parts we find within a bone matrix. And then inside here we have the little osteocytes with the little canaliculi communicating within for each one. This is a beautifully drawn bone. Please do not judge it. But this is a good representation of just the basic structures of the microscopic anatomy of the bone. Make sure you understand the steps in bone healing. So the first step there is that hematoma formation, and then that fibrocartilaginous callus forms, then the bony callus forms, and then bone remodeling then finally occurs where that compact bone gets laid down. Remember that parathyroid hormone is increasing that osteoclast activity. Best example of a sesamoid bone, that's your patella. A good one to remember. I think that's all for chapter 6 here. The rest, yeah, I think that's good for chapter 6. So the rest is understanding the skeletal system, which is, a pretty heavy part of the exam. So to do that, I'm going to use my little app on my computer here. called Organ Anatomy. Let me pull this up real fast. So here first, I'll write down here. So chapter 7 is then skeletal. Oops. Skeletal system. So this is where you are naming the bones. Yes, you do have to know them all, like I said at the beginning. All right, let me pull up Organ Anatomy here. This is a nice little program and a little better than that zygote body one that I showed you in class. So this one does cost money. It's not perfect, but it works. I like it because you can see the skull bones or the cranial bones here. So let's just, let's just go through it and name all the bones, and I'll identify the important parts. So first here on the cranial vault area, we have the frontal bone. Remember, this is the coronal suture that then connects to the parietal bones, and between the parietal bones we have that sagittal suture. Those are the two main sutures that you guys should know. On the side of the skull here we have the temporal bone. Right there is where the external acoustic meatus is. Here's a zygomatic process. Right there's the mastoid process, and right there's the styloid process. Here we can zoom in on this a little bit more here. Then on the back of the skull we have the occipital bone. At the base of the occipital bone, so we have these little crests back here where we have ligament and muscles attached. At the base here we have the occipital condyles where C1 attaches. Remember, C1 is what allows you to nod your head yes. Then the giant hole in the base of the skull, that's the foramen magnum. Important one to know. Now these sutures, I'm not going to probably directly examine you on. Then right here, this is the sphenoid bone. Remember, this is the bat-like one. So if I isolate this one right here, we can see that bat-like structure. Here's the lesser wings. Here's the greater wings. Here's that pterygoid process. This is the sella turcica, which is the base part of the sphenoid. So if we de-isolate this and then let's fade this and then look inside here, we can see where that sphenoid bone sits. Remember, the sphenoid bone is known as the keystone bone because all these bones form sutures with it. So it's a very, very important bone in the head. And then on the back of that, so right there is that lesser wing. Right there is the optic canal. That's where the optic nerve goes. Right here is the supraorbital fissure. So right there on that sphenoid. And then right down here is the infraorbital fissure. Two important fissures we have in the back of our eye. Let's display that one back again. So there you can see those fissures in that optic canal where the optic nerve goes. So those are the main bones of the skull. And now we get to the facial bones. So down here, this one's the easy one. This is the mandible. Back here we have that temporomandibular joint. Then up here, these little holes right here, these are the mental foramens. There is also a mandibular foramen back in there. Then we move up here, so all the teeth are sitting in these alveolar processes. Then we move up here to the maxilla. There's a left and a right maxilla. The maxilla articulates with a lot of bones in here. One being the zygomatic bone. This is where your zygomatic arch is. So if we add a muscle here, you can see where the masseter connects. So the masseter is the main muscle for chewing. So these are major attachment sites for muscles, which we'll get to later. Let's turn the muscles off for now, though, because I don't want you guys to go crazy too much yet. And then on the front of your nose here, you have your two little nasal bones. Those are the ones that are popular to break. Inside, separating the nose, you have your vomer. Alongside each vomer, you have your inferior nasal concha. Remember, these create those little nasal meatuses, which help turbulate the air as it comes in. Right here, you can see that little groove where your tears go. That's your lacrimal bone. Back here, this is your ethmoid bone. And here, let's hide or fade this frontal bone again. And then if we look down, so the ethmoid bone has a left plate and a right plate. And then right there is the cribriform galla and that crista galli, that rooster top. So this is where your olfactory bulb is for smell. So here you can see how that would work. It goes right up there. And then there's a, let's see here. We have to go inside here to then, let's actually hide the maxilla. I know this is looking weird now because all the teeth are still there. So now inside here, this is the one I want to show. This is the Palatine Bone. So if we're looking at, I guess we could have gone this way. Let's hide the mandible. Hide the mandible. Yeah, that works. It just still shows the teeth. But here's the front part of the hard palate is the maxilla. The back part of the hard palate is the Palatine Bone. And then that's the horizontal part. And it has a perpendicular part then as well, which forms the back of the eye socket, just a little bit right there. And also the anterior or posterior portion of the nasal cavity. So that's an important one. So let's add these bones back in a little bit here. But here you can see how delicate this internal structure is in here. And then right here is that pterygoid process of the sphenoid. So hopefully this helps show the facial bones a little better for you, because I know they can be tough. I think I got them all though. So now we'll move down here. So this is the hyoid bone. Again, it's not connected to anything. Go down through the vertebrae. First one here is the atlas. That allows you to say yes. Second one is the axis. That allows you to say no. It has that knob-like feature called the dens. And then we go down here. We want to find C7. It has that prominence. It's what you can feel on the back of your neck. And all these cervical vertebrae have this transverse foramen in them for the passageway of arteries up into the skull. Going down through the vertebrae now, again, you have 12 thoracic ones. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Right there's the 12th. And you can see their spinous processes sticking out. And they also have these little demifaucets where the ribs articulate. So this is the head of the rib. So it articulates right there and right there on these transverse processes. And this allows the thoracic area to rotate together. Now, two of these ribs down here only articulate once. So this actually, that one I think is wrong. But don't worry about that. I won't try to trick you up on that one. Like I said, these programs aren't perfect. But then you get down here to the lumbar vertebrae and you see this giant body. So that's one way you want to distinguish yourself. And then this hatchet-like feature. Then here these faucets are connected to each other, and that prevents the twisting. They're strong connections. So they're almost like they're fused together, but they're not. And then not shown here would be the discs that go in between them, where you then have that fibrocartilage, and how a herniated disc can pop out and poke that region and be very painful. So then along with the axis skeleton, we then have the sternum. There's the body of the sternum, there's the xiphoid process, and there's the manubrium of the sternum, and then you have the ribs. So if we add the connective tissue here, we can see the costal cartilage in ribs 1, 2, 3, 4, 5, 6, and 7 here are the true ribs. The false ribs are then 8, 9, and 10, because they all connect together in one costal cartilage, and then we have 2 floating ribs back here. Remember, this can then ossify as you get older. Let's remove that connective tissue. So that's axial skeleton. Appendicular skeleton then includes the clavicle, the scapula, and also the pelvic girdle. So this is called the shoulder girdle, and this is called the pelvic girdle. Oh, I never talked about the sacrum. Sorry. Here's the sacrum then, and then here's the coccyx. Connects the 2 hip bones together. Can't forget the sacrum. All right, so now we can look at appendicular. Now, the biggest part of appendicular is knowing what's left and what's right. So here first, the clavicle. Notice how the S points outwards. That's one way you can remember. The blunt end goes to the clavicular notch on the manubrium. And let me turn this the right way here. So yes, so then it attaches to the acromion process of the scapula right here. This is then the coracoid process of the scapula. Coracoid process is a major attachment site. We add a muscle, look at that right there, to the coracobrachialis. Oh, look at that. Doesn't that make sense? The coracobrachialis attaches to the coracoid process. All this will start coming back when we talk about the muscle. Oh, look at this other attachment here. The biceps brachii also attaches to it. So here, a few things to keep in mind for some of these important attachment sites. All these processes and weird things look weird now, but they are important attachment sites for muscles coming up later. So here, the S points out flat end this way, so it's important to know which clavicle is left and which clavicle is right. Same with the scapula, so the spine faces posteriorly. And then here, the long border is the medial border, and it points medially. And then this is the lateral border. This is the infraspinous fossa, the supraspinous fossa. And then in the back here is the subscapularis fossa. And then if we add the muscles in there, right there, that muscle, look what it's called. It's called the subscapularis. Whoa. So that's how it all goes together. It all starts building together. And this is why learning the skeletal system is so important. Then we get down to the humerus here. This is your arm bone. So make sure you understand the direction from this. Right back here is the olecranon fossa. And that's how you know what's posterior and what's anterior on the humerus. And then you follow the glenohumeral joint up here to realize which side it goes. And then we move down to the ulna, which has that U shape in it in the back, and that's where your elbow joint forms. And then the radius articulates on the capitulum here, which is that rounded joint. Now remember, when you're in anatomical position, the radius is lateral and the ulna is medial. Now, if you turn your arms inwards, then your radius is not. So know which one of these is medial when in anatomical position. And then the radius has this radial tuberosity here. We add the muscles back. Oh, don't want to add all the muscles. So here, you can't see it. Let's not worry about that yet. There, the radial tuberosity is a major attachment site for muscles too. And then here you're forming that little cup. So you want to find these little styloid processes at the bottom of the bones to help you with left and right as well. Then we get down to the little wrist bones here. We have the scaphoid, the lunate, the triquetrium, the pisiform, the hamate, the capitate, the trapezoid, and the trapezium. And then here is your little thumb. Here are little sesamoid bones in your thumb. So these, again, are your carpals. These are your metacarpals. And then these are your phalanges. So your thumb only has a proximal and a distal, but then your other fingers have proximal, middle, and distal. Remember that. All right, now we move down to the hip. Hip is made of a couple bones, 3 bones. So this is the ilium, this is the iliac crest, and then this is the ilium. And then this one is the pubis, which is where you find the pubic symphysis. And then the one down here is the ischium, where you find the ischial spine, which is right back there. Hard to see. There it is. Right back there is the ischial spine. That's how you can remember this. So ilium, pubis, and ischium. And then the main hip joint right here is called the acetabulum. And this is the head of the femur then. And this all connects right there. The hole in between the ischium and the pubis here, that's called your obturator foramen. Giant hole where a couple nerves and stuff run. But then right here on the femur, remember left and right femur, you want to look at that ball and socket joint and then orient yourself with the direction of the base of the femur, where this fossa is towards the posterior side. The femur is also unique because it has the greater, zoom up here, has the greater and lesser trochanter connected by the intertrochanter crest right here. Moving down, this is that fossa. These are the condyles, which then articulate with the tibia. So there we have the epicondyles right above it, and then the condyles are down here, articulating with the tibia. Now remember, the tibia bears all the weight. The fibula does not bear any of this weight. The femur is the biggest and strongest bone in the body, though. Now in the ankle, we'll get to the ankle then. I won't talk about that then yet. But here first, the tibia, left and right. Remember down here we have the medial malleolus, which is on the medial side. You can feel that on the inside of your ankle. Then the lateral malleolus is back here. Remember we talked about in class how this doesn't show it too well, but this side of the fibula goes down a little bit further for the lateral malleolus. And that's how you can tell the left or the right fibula. So if the longer part is on the forward section here, you know it needs to be flipped around to the other side. So that's an important one for left and right. Remember, the fibula is lateral because it has an L in it and it's not weight bearing. Then down here, as we get lower, the main articulating bone with the ankle to all the weight in your body then is then your talus. And then the biggest weight-bearing bone in your body, or the most weight-bearing bone in your body, is in the calcaneus. And you have a few bones down here. You have your navicular, which is the rectangle one, the cuboid, which is the cube-shaped one, then your lateral, intermediate, and medial cuneiform. And then, of course, these are your tarsals. Then you have your metatarsals, and then you have your phalanges then as well. And your big toe, again, only has two, only a proximal and a distal, whereas there are three in the other toes. All right, that was a little rundown of the skeletal system. I hope that helps you. I know we didn't have a lot of time with the models, so I hope that's a good little review for you for the skeletal system. So let's go back to OneNote now and finish anything else we need to talk about. Oh, let's see here. Again, know the different parts of the spinal column. So what the coccyx is, the thoracic vertebrae, the axis, the lumbar vertebrae, the atlas. So the bone that forms a part of the nasal septum, remember that's the separation between the left and the right nostril, that's your vomer. The bone that does not articulate with any other bone in the body, just only has muscle attachments, that's your hyoid bone. There are also no intervertebral discs between two of your vertebrae. If you think about it, it's the two that articulate with each other, the atlas and the axis. So because they articulate with each other and help you say yes and help you say no, there are no vertebral discs between them. That's one thing I forgot to say. I'm talking about the vertebrae. The most flexibility then, remember, are your cervical vertebrae. Remember, if you ever see the word articulates, that means it attaches to it. So like the acromial end of the clavicle articulates with something like the scapula. Remember, zygomatic bone forms a prominence of the cheek. Know the different curvatures of the spinal column. So like a lateral curvature is scoliosis, and you can have hunchback, kyphosis, and you can have lordosis, which is pot belly. Remember the keystone bone, again, is that keystone bone. Antebrachium. It's a region. It's also known as the forearm. Antebrachium is where you find the radius and the ulna. Then yeah, I think that is good. Remember, so like, I know this one's tough because all these bones are kind of new, but I think you guys are going to do well if you just understood everything I went over. I know I didn't write anything for skeletal. That's because I talked it all while looking over the skeletal system. But just understanding orientation left and right will help you tremendously here. And of course, you have to know the name, but then you have to know a little more, like what's left and what's right. Remember that costal cartilage. Is that hyaline, elastic, or fibrocartilage? Remember, that's hyaline cartilage. So the costal cartilage of your ribs is hyaline cartilage. It's one thing I forgot to say. I might have just forgot to say it. I don't know. But I think that is all I have for this review session. A lot of information, but only 3 chapters. So if you guys are studying and have any questions, feel free to let me know. Just remember, review the lecture quizzes, review the virtual labs, and also review the Kahoots. I sent you all the public links to the Kahoots. Those skeletal ones will help you a lot in naming the different parts of the bones of the skeletal system. But yeah, if you do all that, you will do well. If you don't do all that, you might not do too well. But I have confidence you all will do well. But that's all I have for this review video. I hope it helps you, and I hope it helps you realize where you might need to study a little more before the exam. So with that, I'm going to let you guys go, and good luck studying, and see you all at the exam. Bye-bye.